I'm Brenda Ehlert, the Infection Prevention Coordinator for Affinity Health System. Influenza is a respiratory illness. Usually your symptoms are high fever, sore throat, stuffy nose, body aches, headaches, fatigue. In children it could be nausea, vomiting. A common cold is caused by several different viruses out there, not necessarily the influenza virus. The influenza, what makes it different is that a cold is you get a really high fever and your body aches and you just, it takes a lot out of you, more than a cold would. Treat the symptoms. If it gets worse and your fevers won't go down with fever relieving medication like Tylenol or things like that, then you should seek your doctor. If you have seizures or any other complications, then seek medical advice, nurse direct. We typically see 5 to 7 days. Sometimes it lasts, it depends on the person. And again, if they are one of those high-risk people that can develop other complications due to the influenza virus. It is recommended to stay away from other people and stay home if you're still having a fever. And then once your fever stops and you're not taking any medicine to stop your fever, give yourself about 24 hours before you go back to work. Well, the best way to prevent it is the vaccine, but also washing your hands, covering your cough and sneeze with tissue is also a good way to help to stop spreading it. Hand hygiene or hand washing is the best way to stop spreading germs, and that can be from using soap and water for 15 to 20 seconds with friction, or it can be using the alcohol-based hand sanitizers as well. And you should use it, before you eat, before you drink. We teach people at the hospital to use it before we give patient care, and then after patient care as well. The vaccine makes antibodies. What happens is every year they try to predict what strains of influenza are going to occur in the community, and they use 3 different strains of influenza to make the vaccine, so that when you get vaccinated, your body makes a defense mechanism, so that if it does see that virus, that it can combat it and try to fight it off. Sometimes you'll still get some of the milder symptoms of it, but it's to try to help from getting the severe illness. People, especially people who are at high risk of getting severe illness, like pregnant women or children, or the people over 65 and people with asthma, really need to get this vaccine to help them fight off the complications that they could have. Some people are afraid of needles, so they'll go with the nasal. There are some limitations on age that the FDA has put on the nasal, so not everybody can get it. The people who are going to care for these kids that are under 6 months who can't get the vaccine, it's very important for them to get vaccinated so that they don't spread it to those people who can't fight it off.